posture. अब correct posture क्या होता है? मूड नहीं है, नहीं करेंगे एक्सरसाइज.
Make your birthing plan. The main reason of back test is because we don't take care of ourselves. Like now it's nothing like a normal delivery. We always say a safe delivery. हेलो गाइज, नमस्ते जी, राम राम, कैसे हैं आप लोग सब? वेलकम बैक टू द चैनल गाइज. होप कर रहे हैं कि आप लोग सब एकदम मस्त होंगे, स्वस्थ होंगे जी, बिल्कुल हमारी तरह. तो आपके लिए पेश कर रहे हैं एक और एपिसोड प्रेगनेंसी वर्कशॉप पे. तो जैसे आपने लास्ट व्लॉग में देखा कि फर्स्ट एपिसोड में कुछ मेजर पॉइंट्स कवर हुए थे, वैसे ही आगे कंटिन्यू करते हैं इसी वर्कशॉप को. तो चलिए फिर देखते हैं इस व्लॉग में आपके लिए आज क्या है. लेट्स डाइव इन स्ट्रेट अवे टू दिस व्लॉग.
Roly poly, clap. Now. Music भी बंद हो गया. Okay, so आप लोग में से कौन-कौन एक्सरसाइज कर रहा है ड्यूरिंग प्रेगनेंसी? As couples, have you started doing? क्यों? Low line है? हाँ. अच्छा, ठीक है. So low line में of course you don't do exercises. Apart from that, if everything is going fine, then you can. ठीक है. And sitting, this thing is one thing, and the other is you can stand also and you can do some steps. ठीक है. वो भी हम करेंगे, but अभी ये करते हैं. Let's do this, okay? So can we? Guys, clap. Clap. It goes electric, baby, when I turn it on. How Garbha Sanskar is very important for all of you during this time specifically.
So hello everyone, I'm Dr. Priya, physiotherapist here. Thank you Divya for the introduction. We'll be talking about antenatal exercises today. And see, I would want to know how many of you are exercising. लोग exercise कर रहे हैं अभी? Just one. Walk पे कितने लोग जा रहे हैं? Everyone. Any contraindications कि डॉक्टर ने मना किया है for exercises or any such thing?
Yes.
Okay. Reason?
He said that I have low placenta.
Okay. ठीक.
He said yeah, after 1 month we can do the exercise.
All right. So starting with, we'll talk about few changes that takes place in our body. Especially the musculoskeletal changes in your posture, because your posture keeps on changing throughout your pregnancy. In the first trimester, you cannot observe many changes. So normal curve में क्या होता है? We have a lumbar curve, ठीक है, which is a concavity at the lower back. As you can see, as the belly grows, the core muscles they are very much stretched out. जितना वो stretch out होंगी, हमारे lower back पे strain आएगा. This curve is also exaggerating. You can see in the picture. How many of you are having any musculoskeletal issue? Any aches and pains? You're exercising also? Great. Pains. Calf cramps, so lower back, pelvic pain. ये छोटी छोटी चीजें हैं which comes up. It happens because of your hormonal changes as well as because now your ligaments, muscles, they'll start to become loose and lax. body mechanics in your everyday task will play a major role now. अब body mechanics क्या है? जैसे आप उठ रहे हो, बैठ रहे हो, how you're lifting, doing your everyday task, ठीक है? That plays a major role because exercise you'll be doing once a day. But throughout the day अगर आपका posture गलत है, that will obviously nullify that, right? Whenever you're sitting for a long time, working in the office or at home, make sure you're sitting in a correct posture. अब correct posture क्या होता है? That your shoulders and lower back should be supported. Okay, you should be sitting with complete support against the backrest of the chair or the bed, wherever you're sitting. Now, how to do the everyday task? हमने body mechanics के बारे में बात करी. How should we do it? In case you want to pick something from the floor, reach out for the lowermost drawer. How will you do it? Squat down rather than bending down from your back. Because हमने देखा था posture change हो रहा है. The lower back muscles are already strained. The core muscles are weak. Stretch out हो रही है. We don't want that abdominal pressure to rise. अब इसमें सिर्फ pregnancy के time पे back pain के chances नहीं है. Even in the postpartum, because your core muscles are getting stretched out, no, there comes a gap between those abdominal muscles, which we check in the postpartum phase. Place one foot forward, one at the back, and then go down on your knee, rather than bending from your back and straining your muscles. How many of you know what is the ideal amount of exercise one should be doing during your pregnancy? 5 days a week. Very good. See, 150 minutes. So 30 minutes a day and at least 5 days a week. Okay? The more you are keeping yourself active, the happy hormones, we all know the reasons, right? Exercise क्यों करना चाहिए? It will help to control your blood sugar levels, lesser mood swings, happy hormones will be on the rise. Again, you know, it will improve your sleep and mood. Next चीज जो होगी, it also reduces the constipation because your gut mobility is improved. How to do the Kegels now? We know the importance of it कि urinary incontinence prevent करेगा. Sometimes the pelvic floor is weaker. It also is a cause of back pain. Okay? How to do this? Firstly, empty your bladder, lie down in a quiet place because you need to focus more on the movement. It is to avoid faulty movements, trick movements, avoid करने के लिए just lie down in a quiet place because you will require a bit of focus. It is a deep muscle, कोई movement होते हुए नहीं दिखेगी आपको. So for Kegels, what we'll do, imagine you are trying to stop or hold the flow of your urine. Now you just have to imagine कि आप urine pass कर रहे हो and you suddenly have to stop the flow. So you will squeeze up your pelvic floor, right? That squeezing up movement or contraction is your Kegels. How many of you know कि कब exercise नहीं करना चाहिए? One of the reasons, low-lying placenta. Any other reasons you think when not to exercise? Anybody? Mood नहीं है, नहीं करेंगे exercise? No. Whenever the first thumbs up is by the doctor, your obs and gynae. If she is giving you any red flags ki nahi, please stop exercising. Do not go against their advice. You have to only exercise once you're given a green flag. So in case there is low-lying placenta, you have any restrictive lung disease where you need, you know, it will compromise with your breathing pattern, do not enroll in an exercise program. Now, because we know exercises करना चाहिए, we need to change it with each trimester. Initially in the first trimester, we need to just do simple circulatory movements, breathing exercises because there is a lot of changes, hormonal changes which are happening in your body. You need to change the exercises also. First trimester में mostly circulation and breathing. As your posture starts to change in the second trimester, you also need to change the exercise. So you'll be we mainly focus on the strengthening part. Your core muscles, glutes, your hip muscles, pelvic floor, हम उस पे focus करेंगे उसको strengthen करने में. As your third trimester follows, we will now start with your pelvic stretching and hip opener poses to prepare you for a normal delivery. This is your childbirth preparation class. We have this special class here which is a Lamaze class specially designed for the first time mothers wherein we prepare you for the labor. We talk about the labor essentials, how to cope up with the labor pains. Okay, what you can expect in the delivery room, what exercises you can do, how your partner can support you. All of these things are taken care of. Also about the early newborn care, like swaddling and the first breastfeed. All of these things we teach you in the Lamaze class, which you can start at the 7th month of your pregnancy. In case you're sitting on the bed, you can raise your feet up also. Otherwise, you can place a stool. In case chair पे आप बैठ के काम कर रहे हो, you can place a stool. 45 minutes के बाद, for every 45 minutes, take a break for 5 minutes. थोड़ा सा change your posture. Any other questions?
जैसे अगर बैक पेन होता है तो उस केस में अगर स्ट्रेट ले कर रहे हैं तो बैक पेन हो तो उस केस में क्या?
अगर आप straight flat lie down कर रहे हो तो ठीक है, you need to change your posture. Again, you can place a pillow under your hips. Okay. Ideally, it is not advised to lie down on your back for a very long time because it will, strain your lumbar spine. It is advised कि आप left side पे ही लेटो and use a pillow between your knee. In case you're lying down on your back for some amount of time, you can use a small pillow under your hips, okay, and bend the knee. So it will prevent that lumbar curve or that anterior tilt, जिसकी वजह से usually pain आता है. Over to you, Divya.
Thank you, Priya.
Thank you so much.
Afternoon to all of you. Hope you guys enjoying your session today. So just taking a short topic about what exactly do you know or mean by painless vaginal delivery. So this is more of benefit for people who are already pregnant and are towards that phase, and also if you are planning a pregnancy to have that less care of delivery, I think this would help you. So coming to that, what exactly happens when you are pregnant. You see this diagram over here showing you that your pregnancy basically has 3 stages. This is basically the stages of the time when you actually go in labor. That is, you come to the doctor that ma'am, पेट दर्द हो रहा है, बैक से पेन आ रही है फ्रंट तक, and no matter whatever painkillers we are taking, the pain is not subsiding. Also, there is a lot of pressure in our perineal area or the pressure in our vaginal area. You might even come that ma'am leaking ho gaya hai, there is a bag of water which has burst, and now when a patient comes to us, she is exactly in labor where no matter what we do, pain is not settling. In fact, the pain increases in intensity, frequency and duration. So friends, here we see that in the initial phase, this is your baby, this is your womb, and this is your vaginal tract. And what exactly happens is that during the labor process, this mouth of the uterus, that is known as the cervix, it begins to dilate, and once it has dilated, when we call it the active phase of labor, and then through this vagina the baby actually comes out, which is the second stage of labor, and in the third stage the baby is out and your placenta and the afterbirths, that is the placenta, the umbilical cord, all these things come out. So this is exactly what is usually happening. Now, of course, this is another place which is showing us the different stages. Initially, there would be a dilatation of the cervix from a closed, it will be going somewhere around 10 centimeters. Then the birth of the baby, where the baby is being delivered from the birth canal. And number 3 would be the delivery of the placenta and the afterbirths. So, what are the various signs when you come to know that, okay, my labor is there, it has started, or it is very near? Now, why is vaginal delivery so important, or I should say why we always focus on a vaginal delivery? So friends, there are various benefits of this form of delivery. Of course, you all know that you would have discussed in the previous lectures what are the 2 forms the baby comes out. Either the baby comes out through the vagina, which is known as the vaginal delivery, or the baby comes out through the abdomen, where we give a cut on the abdomen and we take out the baby through the abdomen, which is called a cesarean section. Now many times people ask, ma'am, better क्या रहेगा, vaginal better रहेगा या cesarean better रहेगा? I always say that, see, for you and your baby, whatever is the safest is always the best option. And if everything goes by normally, everything is fine, your baby is in a right position, you overall don't have many high risk factors, even if you are having some high risk factors, they are in control, there is no proper indication that one needs to take out the baby through the abdomen, you all should always motivate yourself that you need to undergo a vaginal delivery. And of course, the mother and baby interaction also improves. So again, just a slide telling us that it will lead to a shorter recovery time. There is a better bonding between you and your kid because of the hormones which are being released while you are in labor. There would be a better bonding, and breastfeeding can be initiated as soon as possible. There is a sense of empowerment. As I said, you come out as a winner. You feel that, oh, I did it. Now, what are the different things which will help you achieve this vaginal delivery when you actually go in labor? We always tell our patients, don't be just on the bed. When you come to the labor room, if everything is fine, please keep moving around. Be very active even there in the labor room. Go for a walk. You can take a warm shower. You can listen to nice music. Relaxation exercises should be there. So certain, again, natural remedies which help us in pain relief. Of course, you should have a labor support partner. I always tell everyone in your last trimester, make your birthing plan. Have a birthing plan. Okay, who would be there with me when I go for birthing? It could be anyone. It could be your friend. It could be your sister. It could be your mom-in-law, your husband. Whoever you feel comfortable with should be there with you during that phase to motivate you. Of course, physically you have done a lot for yourself, but that emotional support will really help you during that time. Now, a very big question which people ask is, what is epidural analgesia? People coming to the OPD, मैम अब तो सब ठीक चल रहा है, वी आर गोना गो इन लेबर इवेंचुअली, पेनलेस लेबर के बारे में मैम सुना है, एपिड्यूरल के बारे में सुना है, मैम होता क्या है? So what exactly is epidural? See, epidural is a condition where we give an injection in the back of your body. So in your spinal cord, we give you an injection. It doesn't look as scary as it is. It is basically just a prick. And what happens is that when you give that, you put a tube inside, and through that you give some drugs. What is that going to do? It's going to anesthetize your body from your waist. So you would be feeling less amount of contractions what you were feeling before, and the good part is that within 5 to 10 minutes it has its role, and actually the pain relief starts coming in play in the next 5 to 10 minutes again. So epidural analgesia is one thing which can help you shorten your labor. See, all said and done, saying ki I want to undergo a vaginal delivery or having that thing कि मुझे vaginal कराना is very good, but then there has to be sometimes a push required, because उस समय पे when those pains come, then किसी को कुछ नहीं सोचता हमने क्या मोटिवेट किया था, क्या बोला था, anything, वो हस्बैंड को 4 गालियाँ पड़ रही होंगी, सिस्टर को पड़ रहा होगा, सब कुछ, there is a chaos. नहीं, आई डोंट वांट टू गो, मेरे को सिजेरियन के लिए जाना है, एज सून एज आई सी द डॉक्टर्स फेस, मैम मुझसे नहीं होगा, सिजेरियन कर दो. नाउ रादर देन एक्चुअली गोइंग फॉर अ सर्जरी, एपिड्यूरल हेल्प्स यू इन व्हाट वे दैट pains would be there, but you will not feel those pains that much. So it helps you move during that time. It helps you reach that final stage of labor when your baby has to come out. So it's just those initial contractions which one needs to take, and once you are in active labor where maybe your cervix is 3 to 4 centimeters dilated, we take a call for epidural, and I will not say that it has no side effects, but it's at least better than actually undergoing a cesarean for no cause at all, because sometimes people just lose hope. They feel कि भाई हमने तो इतनी दर्द कभी ली नहीं. Now this is again a diagram or a picture which will tell you that, see, that's a laboring woman, and the anesthetist comes and he just puts a small prick in the back of the lady, where when this catheter or this tubing is put, we put certain drugs which anesthetize these nerve vessels, and you will see that this lower part of the body becomes anesthetized. So patient will be having pains भी अच्छी हो रही होंगी, progress भी अच्छा चल रहा होगा, but she will not feel the pain. She might feel it, but the perception will be very low. So it will actually help her in succeeding through a vaginal delivery also. This is again where we have just shown that this bluish area down will just get numb. So your pains are coming, but you will not be actually feeling it that much. Now, what are the advantages? Number one, that it is highly effective and it's easily adjustable. So if someone we feel that okay, हमने इतना epidural दिया drug लेकिन patient को फर्क नहीं आया है, so we can top it up. Maybe we feel that okay, now she is almost progressing and we want her to push, we stop the epidural. She'll start feeling the pains and then she begins to push out the baby also. So it is adjustable. It helps us. Secondly, you remain awake throughout the delivery. It's not कि भाई हम बेहोश पड़े. We know everything. We are talking, we are smiling, we are enjoying our labor, we are doing whatever we want to do, we are taking our pains, and at the same time we are very much aware of what's happening in the labor room. Sometimes people with high blood pressure, there are many people who sometimes have higher blood pressure in during your pregnancy. So in those phases also epidural helps to lower this blood pressure. This again that that it's very normal to feel the pressure as the baby gets lower and the tissue stretch. So many times people feel that अगर epidural लिया है तो हमको वो stretch नहीं feel होगा. You feel a little bit of stretch, you will feel a little bit of pain, but it's overall it doesn't hamper with your progress of labor. So for all of you over here, it's very necessary that be motivated from the start कि भाई vaginal का try देना ही देना है. Yes, if things are don't go our way, maybe that very much day, at least you are satisfied that you gave your best. Then if you undergo a cesarean, it's okay. But having that thing कि मैम मुझसे तो दर्दें नहीं ली जाएंगी, आप cesarean कर दो, directly surgery कर दो, is not something what we should actually have for our body. Alright, so any other questions? If anyone wants to ask something, please let me know. Yes.
Does the epidural pass on to the baby also and is there any effect?
No, usually it doesn't. The anesthetic drugs which we use are almost similar to what we even do during cesarean. It's just to block your your nerve roots. So that's just that you should just block them. You don't feel the actual pain of the good contractions which are actually coming, and you can proceed further with your vaginal delivery.
Okay. I mean, the general recommendation is to not take a lot of medicines during the whole pregnancy. So that was...
See, when we talk about not taking medication in the pregnancy, it depends upon how much pluses and minuses does that medicine have. Now, any medicine, even paracetamol would not be 100%. Not even iron is 100% safe to be taken. But then, of course, we have to judge how much pluses it has. And if the pluses are much more, then of course we need to go.
So at what stage typically epidural is given? At what stage?
Usually when you are around 3 to 4 centimeters dilated. If you take it too soon, it's not going to help. If you take it too late, again the success is low. So that's why it's very important for the gynecologist to judge what is the right time to take it. Some people take it too soon in delivery and then it causes an issue also. So it has to be taken at a particular time. It's like that.
Yeah, because you were also mentioning one has to keep walking around.
Yes.
So with epidural then you will not be able to walk.
No, you can. Yes.
You said that it will get...
Numbness would be there, but it is not that you would be again feeling the pain would be a little lesser, but it helps you to move around. It doesn't make you completely static. And there'll be, there'll be help in the labor room also. It's not that you are alone. So you should be moving around, and if you can actually go without it, that's the best, because you're not taking anything. It's absolutely natural.
Doctor, I have a question.
Please.
Though I'm a mother of 9, but I've heard since my pregnancy and before that also that if you go for a C-section, then you usually face backaches throughout your lifetime. So I just want to know that is it a myth or it's actually...
No, it's nothing like that. See, backaches usually can happen, whether you undergo a vaginal delivery or a cesarean. The main reason of backaches is because we don't take care of ourselves. Once that baby is out, we just had a session on postpartum where we discussed that once the baby is out of your body, you just forget everything about your own self and just focus on the body. आपका छोड़ो, घर में सब लोगों का focus सिर्फ उस baby पे होता है. You forget that you were the one to get that baby out. I always say, don't be sitting on the on the bed. Take a proper chair, take a proper footstool if you want to. Sit on that, feed your baby properly so that your back posture is good. Support your back well. You can maybe order some orthopedic cushions if you want to, or even normal cushions. Take a proper cushion on the lower back and you will feel more relaxed in actually, feeding your baby. Then the backaches are less. It's nothing related to a C-section or a delivery at all.
That's correct, because I've heard so many mothers, after I...
Yeah, no, we hear that as well, yes,
they
yes.
come up and say that, I've had a lot of backaches and I've had C-section.
Yeah.
So I tell them, even I had a C-section, I have nothing. No, like a inch or a centimeter of a backache.
Yeah, so that's how it is, that it is not a myth, and it's actually not now it's nothing like a normal delivery. We always say a safe delivery. Now whatever is the safest option for you, you need to go in for that. Of course a vaginal is always preferred than abdominal route, but then if you are in a situation where the baby is breech, बच्चे का head ऊपर है, body नीचे है, if you have a placenta previa, that is your placenta is low lying, if during labor baby ने अंदर motion pass कर दिया है, baby is about to aspirate, all those things are happening, then in that sense you can't be on your thing कि नहीं मुझे तो vaginal delivery करना है on the stake of our baby, because for us the mother and the baby are the first and foremost, and then comes the mode of delivery. So mode of delivery, if everything is fine, our first aim is a vaginal delivery. If it doesn't work out, बच्चे को तो बाहर लाना ही है, then of course one needs to go in for cesarean, and even cesarean is equally safe these days.
Can one have a delivery without having perineal tears?
See, it depends upon 3 factors. When we talk about a delivery, your 3 P's have to be in place. That's your passage, your passenger, and your power. So when I talk about the passage, that's your pelvis. When we talk about power, it's the contractions which you are having, and when we talk about the passenger, that's your baby. Only when all these 3 things are aligned will you actually have a vaginal delivery. Now, if the perineum overall is a little stiff, if the perineum is not that lax, if the baby is bigger than actually your pelvis space, then yes, perineal tears are common. That's why we self-inflict a perineal tear, which is actually called an episiotomy, which straightens that canal, which at least helps you have that baby come out smoothly.
जैसे अभी हमारा जैसे 18 मंथ चल रहा है, तो 18 वीक चल रहा है, तो उसे लो लाइन प्लेसेंटा का प्रॉब्लम है, तो ये आगे ठीक कैसे? देखो 60 to 70% में अगर लो लाइन प्लेसेंटा होता है, बाय द टाइम बेबी का टाइम पास आता है, डिलीवरी का टाइम पास आता है और आप फ्यूचर अपने अल्ट्रासाउंड्स कराते हो, उसमें 60-70% टाइम वो ऊपर चला जाता है, बट फिर भी 20 to 30 पेशेंट्स में ऐसा होता है कि वो ऊपर नहीं जाता, एंड उसमें इट्स वाइज टू गो इन फॉर अ सिजेरियन. इन अ लो लाइन प्लेसेंटा है, जो प्लेसेंटा नीचे, हाउ इज द बेबी गोना कम आउट? यू कांट, वो कर ही नहीं सकते, क्योंकि बेबी यहाँ है, बीच में प्लेसेंटा है, नीचे वजाइना है, तो वजाइना और बेबी के बीच में वो प्लेसेंटा की दीवार होती है, तो कहाँ से बेबी आएगा नीचे? All right, thank you all of you. Hope the session was useful for all of you. We have Dr. Shalini with us, who would be talking about the various imaging. She's a radiologist at Motherhood. She'll be helping you with the imaging part. Over to you, Dr. Shalini.
Hello.
तो गाइज वर्कशॉप के नेक्स्ट पार्ट में जाने से पहले इस व्लॉग को तो करेंगे यहीं पे एंड, और इस व्लॉग को आगे कंटिन्यू करेंगे कल के व्लॉग में. तब तक के लिए आप रखिए अपना ख्याल, और ज़रूर बताइए अगर आपको ये व्लॉग बहुत अच्छा लगा हो, इन्फॉर्मेटिव लगा हो, तो प्लीज़ एक कमेंट छोड़िएगा, और जितना हो सकता है इस वीडियो को शेयर करिएगा, क्योंकि ये बहुत सारे कपल्स के लिए जो प्रेगनेंसी एक्सपेक्ट कर रहे हैं या फिर प्लान कर रहे हैं, उनके लिए बहुत ही यूजफुल होगा. तो गाइज मिलते हैं आपसे कल प्रेगनेंसी वर्कशॉप के लास्ट एपिसोड के लिए. सो टिल देन टेक केयर, गुड नाइट, एंड डोंट फॉरगेट टू लाइक, शेयर एंड सब्सक्राइब. बाय बाय, गुड नाइट.
Sarbamba.